So frozen shoulder is one of those things that I see quite a bit in here with athletes and even stay-at-home moms, just anybody who's had it. It's usually from a shoulder injury. Frozen shoulder is another one of those loose terms that, well, what is it? My shoulder's frozen and it won't move. Could have been from a fall, from falling out like this, where on Minnesota winter on the ice or something, you fell out and everything tore, or you were lifting something heavy that didn't move but your shoulder moved, or just over time the repetitiveness of out here on the shoulder, this is the backside, the rotator cuff and those tendons, they tend to wear out over time with misuse and just repetitive strain. They shouldn't, but with use that's non-optimal kind of mechanics or twisting too far or something, you can strain those. So what happens with frozen shoulder is it's adhesive capsulitis is another term for frozen shoulder, meaning the capsule of the shoulder is adhesed, it's frozen. It's a lot different than muscular injuries that we deal with, because when you have this ligament, it's a ligament down there, and when it undergoes tightness, it's more of a contracture. It's different cells than a muscle where you can stretch it open and elongate it. When I work a frozen shoulder, I have to get way up in there, where it depends if it's on the bottom side of the shoulder or in the upper or on the top. We look at the area that's more adhesed, and when we do the treatment, we have to hold it for a little bit longer, because you're letting these myofibroblasts, it's more of a muscle and a ligamentous contraction tissue, you have to hold it longer to let it kind of release slowly. So it's very effective. Usually it depends on how long this has been there. I have an interesting case from, it was a few years ago. I was treating a drummer that tore his something in his shoulder, and I don't remember what it was, but he developed frozen shoulder. He let it sit for 13 years. So imagine having this trauma, and by the time he came in to see me, he couldn't lift it up. He's like, "Doc, look, I lifted my arm." He had his whole spine bent, so it looked like he lifted his arm, but he couldn't really move it. So there was none of this. He could go out a little bit like this. It was traumatic. Lifting a couch didn't move, shoulder gave way, a bunch of stuff tore. Profession as a drummer, it made it hard for him to work pain-free. So he would just kind of lean and do this and that. So he started chewing up other parts of his body due to this frozen shoulder. So we got in there and we started working it, and very sore, but we did make positive change with him. And over a few months, he saw quite a bit of relief and kept coming in for maintenance. I told him he was good. He's like, "I want to keep doing it because it's helping." So it was one of those cases where you don't win them all, but that was one that really jumps out because it's the worst one that I ever saw, and probably some of the best improvement I ever saw too.
Sure. In a few months, what kind of range of motion was he able to get back in his shoulder?
So he could only at the beginning come up. Like if I said bring your arm out, it was more of this and twisting. You want to have the shoulder moves in the flexion, extension, abduction, adduction, external, internal. He could only do flexion a little bit and it still hurt. His extension, everything pinched. He could not get an external. Combing his hair, it was the left side, but combing the hair, putting a shirt on, I remember putting his jacket on, it was just the most unorthodox style. He'd have to swing it around and try to get it in there. And that whipping motion of just getting dressed would irritate things too. So once we started to teach him, okay, here's the range, here's the safe range we're going to work in. Let's just try to do our rehab and exercise in there. There's no need to go out here because you're not there yet. So we would do that, and it would get better, get inflamed a little bit, but better. But as we kept doing it, and it would build on each visit, he got a lot better and was, very happy with the improvement.
That's amazing. I'm surprised he waited 13 years to come.
He didn't know. I said, well, why would you wait? He's like, I did do some PT and things like that. I'd get some relief, but I hadn't heard about ART, and he did a Google search, led him to my office, and he was like, I want to try this new active release techniques. I've never had it. And so I kind of told him, here's what to expect. Here's what, might be a little bit sore. He's like, I've been sore for 13 years. I'm ready to try anything. So we stayed on it weekly for quite a few months and made a big change for him.
Mm. Do Do you know if he was on pain medication?
He didn't know. He didn't want to take that. He was very holistic and did not want to try that. So, and that's great too when I'm working, because I want to know, is the treatment helping? Because if you're to come in and you took something before your appointment to get numbed up, well, now I don't know what's the safe range to work in. So I always try to have patients come in as naturally as you can. If you want to work out before or after, that's fine, whatever. But don't skew the results by taking something, because I don't know what your new barrier for pain is going to be. As well as I don't like to know. I mean, I like to know if you're doing other treatments. So if you're going to get injections or this and that, we kind of stay away from those areas, because I want to know truly, is what I'm going to do going to help you, or was it your other method of treatment?
Sure, that makes a lot of sense.
One more case study of a nurse that I treated that developed frozen shoulder overnight with nothing. So she no trauma, no anything, just woke up with it, but she wasn't feeling well too. She developed sort of a cold. So there's some cases where you can develop frozen shoulder that is viral induced. So she came in, there was no activity, couldn't lift it out, couldn't do anything. And that was very interesting, because the whole other side was just fine. And it wasn't so much pain, she just couldn't move it. It happened overnight. So having her try to move it, nothing happened. Then I started digging around in there and elicited a few responses like, oh, that's really sore, I can't move it. So I started doing some active release techniques on the back side of it and helping her move it. And then we did some banding and just try to facilitate some things. And after about 30 minutes of working on her, her whole shoulder was moving just fine, like it had never happened. So I didn't know what that was, but I've read some of the research saying that frozen shoulder can be viral induced. So that was one of those cases where it was just like it turned on a switch.
So interesting. When someone experiences a frozen shoulder, what should they do immediately, and how quickly should they come to see you?
So if you've been under care, you would know that I always say, if you have something like this, let me know right away so we can knock it out. But if this is new to you, I would get somebody to look at it right away to see if there was trauma. You usually want to do imaging to see, is there a labral tear? Is there a fracture? Is there some sort of x-ray findings that could be why it's shut off? Because your body knows, hey, let's not move it if it's hurting. Let's stabilize by just keeping it still. If there's no trauma and you want to get it, it's best to have it assessed. Your provider, whoever helps you with movement therapy, myself or PT, just get it assessed to make sure there's nothing wrong. Then sooner you get on something, then the quicker you knock it out. Because if you let things just brew up, tighten up for no reason, it just costs you a lot of time, money, and effort in the long run if you don't address it quicker.
Sure, that makes a lot of sense. Do you see a lot of cases with frozen shoulder?
I do. Early on in my career, I saw a couple of really bad ones that was kind of humbling. Like, wow, the drummer, for instance, came in and I was able to help him. But I've seen a few over the years where one of them had to have a total shoulder just because there was so much that was going on in there that we never resolved. That was another one that I saw that had a total shoulder replacement. But I would say I see probably one a month on average. And it's usually from overuse where you do have an injury and things tighten up, where the rotator cuff tendon up here, you'll get some fraying, or you'll get some just some really nasty adhesions where it's not allowing it to move. Or deep below that, you can get some impingement, or the labral is tearing. So by default, you're going to get a frozen shoulder because you don't want to move it in that range it hurts. So it could be a whole array of different things going on. So there are different diagnostic tests and orthopedic tests that we can do to see what is the tissue that's in question.
Sure. Are there any surgeries, in your opinion, that happen today or these days that can be avoided if people come to you first? What is your experience with use of surgeries to treat some of these issues?
I do think that a lot of the surgeries in this area are over-prescribed, so to speak, just because your body can repair on its own too, and there are new procedures with PRP and stem cell that I work with other providers to do that in conjunction with what I'm doing. I've had patients to go in there and they do exploratory surgery because the MRI was not inconclusive. So they'll get in there and see like there's nothing wrong with this tissue. So you can have issues where it's just so chronic where your body just shuts it down. It needs just to be stimulated and rehabbed with neuromuscular education, manual therapy, a PRP, different things to regenerate some of this tissue. Because what happens is, I keep looking back here at this tendon, there's this common insertion tendon up here where these muscles attach, and you can get full resection of one of those and some of the other ones might be intact. So you can help that tissue regenerate with some of these stem cell and PRP procedures, and at the same time, myself included with the other provider, I'm doing manual therapy around that tissue. They're doing the work in there, and it's just kind of a win-win without having to do any more damage, so to speak. Because anytime you have surgery, there's a benefit to it, but there's also, you have side effects. You cut the tissue, and right away your body has to start scarring to heal that tissue that they have to get to. So try to avoid it at all costs. That's that's just my thought.
Sure, that makes a lot of sense. For people that have undergone surgery and are not seeing relief from it, we see that a lot with different cases, shoulder, back. Surgery was recommended, there was hope given.
Absolutely.
And then the surgery happens and the relief hasn't happened.
Absolutely.
Do you see a lot of cases?
Absolutely. That happens more often than not. With ART being not as well known as kind of mainstream other treatments, I had a gentleman in here on Monday that they cleaned up some calcific tendonitis stuff in his shoulder. I've been doing ART on there. He's like, I wish I would have found you sooner because this is so much better just with getting that motion and that movement back. Because when you go in there and you clean that up or you have a spur, they'll shave it off. It'll be good for a few years, but it comes right back. Because body's response to stress is it's going to put down bone. You can shave off the bone, but if you don't reduce that stress that's adding to it, it's just going to come right back. But I've heard that a lot of times where it'd be nice, someday my goal is to people try, ART and these services first off, and then go the surgical route because it's, least invasive. There, the cost and the rehab time and lost time from work and lost time from having fun and doing what you want to do is, it's just more in your favor.
Sure, absolutely. What is your advice to teenagers that are active in sports and, young adults? Because, maintaining our skeletal system and our nervous system and have it continue to function normally is so important. It's core to us staying healthy.
Absolutely.
What is your advice to the younger generation?
So that comes up a lot right now just because the media and what's going on in the news is sports specific for these children. And I have 2 children of my own, and we try to just have a variety, play what's going on during that season. If you're playing baseball year round or hockey year round, as you're skeletally maturing, that's a lot of stress for anybody. Our age, kids, whatever. But as you're growing and you start to have repetitive strain injuries or let's say compression fractures or anything that can happen to the osseous structures in a skeleton, you're gonna have that issue, and then you have to build on it from there as you continue to grow. So it's just a lot of demand for young kids to keep up with that, playing hockey 12 months a year or baseball 12 months a year. So it's best, I believe, to have a variety of sports where you're always having varied movements, different change, where you're not always going this direction, but maybe this direction or back, different, building the brain too to, map out new movements and learning new things is such, more beneficial than playing the same thing over and over.
Okay, so variety is good, variety is key.
Variety is key.
Wonderful advice, that is very, very helpful. Okay, thank you, Dr. Brian.
You're welcome.